A lot of people don't know why they need to get their wisdom teeth removed, or they've seen people, they've heard people who have been in a tremendous amount of pain, swelling, bruising, but there's actually a really important reason why you need to get your wisdom teeth removed. Wisdom teeth, third molars, really serve no function other than to cause us problems at this point in life. Back in the day, they actually served a purpose when people weren't keeping their teeth as long. But today, they're more of a nuisance than anything, and they're really not needed for normal everyday life. Problems can include gum disease, decay on the teeth that we want to keep, depending on the angulation that they come in, and sometimes they can even cause headaches or your teeth to shift. Some of these problems are very slow in nature, and you won't notice them right away, and it might be too late to do something about it. The majority of patients don't grow their wisdom teeth in straight. It's very, very minor. I've only seen a few cases in my life where they've grown in completely straight. Most of them are at an angle or completely impacted under the bone. At that point, it's best to get them taken out, because the longer you wait, the worse it's going to be, especially regards to age. It's easier to get it done, and it's faster to heal when you're young than it is when you're older. In really severe cases where patients have waited far too long and they're, not in their teens or early 20s anymore, it can be quite traumatic and quite painful to heal. There can be things like nerve damage or paralysis in the area, which can be temporary or permanent depending on the case. And patients can end up losing even more teeth than they had originally anticipated. If a patient is interested in wisdom teeth removal, they should definitely find an office that offers panographic radiographs, cone beam CTs if needed, and I definitely would recommend sedation for any type of wisdom teeth removal. So with panographic radiographs and CTs, it allows the doctor to find the exact position of the tooth in relation to the nerves in the jaw, especially on the bottom where it's more important, where it's more critical. And it also shows the doctor the entire structure of the tooth, whether it's just forming or whether the roots are fully developed. It's a diagnostic aid that really helps should be standard of care before anybody gets their wisdom teeth removed. If you ever go to one of these offices and they don't have these, basic technologies, you should walk right out the door, because you're going to be in big trouble. If you're interested in getting your wisdom teeth removed, come on in for a complimentary consultation. We'll show you that it's not really that big of a deal. We'll make sure you're comfortable, relaxed, and get the treatment you need.